Coping is the most widely studied topic in contemporary psychology. Coping is the process of managing demands, internal or external, that are appraised as taxing or exceeding the resources of the person. There are several important aspects in coping. Relation between coping and a stressful event represents a dynamic process, not a one-time action. Coping encompasses many actions and reactions to stressful circumstances. Therefore, emotional reactions are part of the process. Lazarus and Folkman in 1984 proposed two main categories of coping strategies: problem-focused and emotion-focused coping. Problem-focused coping consists of directing one's efforts at defining the problem, generating solutions, weighing alternatives in terms of costs and benefits, and choosing among them and acting. Emotion-focused coping consists of directing one's energies at lessening emotional distress. It includes avoidance, positive reinterpretation, acceptance, and venting emotions. The greatest efficacy occurs when the nature of stressor and the nature of the coping strategies match. For example, when a person uses problem solving for controllable events or distraction for uncontrollable events. In general, problem-focused coping strategies contributed to good health. Emotion-focused contributed to poorer health. Why might this be? Coping efforts are moderated by the resources that the individual has available. Some personality traits exacerbate stress, whereas others may reduce it. Negative affectivity. Pervasive negative mood marked by anxiety, depression, and hostility. Negative affectivity has been related to alcoholism, depression, suicidal behavior, poor health related to asthma, arthritis, ulcers, headaches, and CAD. Elevated cortisol secretion may be the biopsychosocial pathway linking negative affectivity to health outcomes. But negative affectivity can sometimes create a false impression of poor health when none exists. Beware of self-report data that does not take into account negative affectivity when examining the relation between stress and illness. These individuals may report more stress and more symptoms regardless of what is going on around them. The pessimistic explanatory style may also relate to illness. Siegelman and colleagues note that some individuals characteristically see the world this way. These people see negative events in terms of internal, something intrinsic about the person's situation or personality trait. Global, this is how the person or situation is across all aspects of life. Stable qualities, the situation or person is not likely to change. Two measures of cell-mediated immunity were lower among elderly with marked pessimistic explanatory style. Why is this important? It is evidence of a direct relation between the pessimistic explanatory style and a biological pathway that has health implications. Elderly are already at risk for immune-mediated diseases. Resilience. There are a number of factors linked to resiliency. Finding having a purpose in life, experiencing positive emotions, quality relationships, coming from a cohesive family, for example. Optimism. Generalized outcome expectancies that good rather than bad will happen. Optimism can lead people to cope more effectively and consequently reduce the risk of illness. Research examples. Undergrads were asked to do the Life Orientation Test, LOT, 4 weeks before the end of semester. Students who reported being optimistic were less likely to be bothered by physical symptoms at the end of the semester. The relation persisted even when controlling for initial numbers of physical symptoms reported by students. Coronary bypass patients. The optimists used more problem-focused coping and less denial. There was a faster recovery rate and a faster rate of returning to normal life activities after discharge. Optimism also predicted less rehospitalization following coronary artery bypass graft surgery. Similar results found with bone marrow transplantation recipients. Problem: just as hardiness construct was criticized for its overlap with other constructs, the life orientation test may be confounded with neuroticism, mastery, or perception of control. Pessimism. Mechanisms by which pessimism may shorten life. Experience more unpleasant events. Think nothing they do matters, less adherence in preventative measures. Linked with depression, which is correlated with mortality. Weaker immune systems. It is possible that optimism and pessimism may be important at different times in the coping process. Psychological control. The belief that one can determine one's own internal states and behavior, influence one's environment, and/or bring about desired outcomes. Psychological control is related to emotional well-being, good health, successful coping, behavior change that may promote good health, and improved performance on cognitive tasks. Psychological control is closely related to self-efficacy. Both help people cope. It is especially important among vulnerable populations, medical patients, the elderly, who may be at risk for adverse health effects. Recall the classic nursing home study by Langer and Roden in 1978 on pages 109 to 110 of your text. Additional coping resources. High self-esteem. High self-esteem is believed to moderate the stress-illness relation. Among college students, those with high self-esteem were less likely to become upset in response to stress. However, high self-esteem was more successful in muting effects of stress at low levels than at high levels. More self-confident individuals cope more actively. Conscientiousness is thought to moderate stress-illness relation. The researchers used data collected on many personality traits of individuals in 1921 and 1922 and found conscientious individuals lived longer. What are some possible reasons? They are more successful in avoiding harmful situations. They're more reliable in practice of good health habits.